This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome as a guest Dr. Ian Arra, who is the Medical Officer of Health and the Chief Executive Operating Officer for the Grey Bruce Public Health Unit. I always have to make sure I get that full title in there because you do a variety of tasks, Dr. Arra, for sure. Thank you so much for joining us today. And I know that every time we chat, there's new information and more to come. So I am really looking forward to hearing what you have to share about how we are in Grey Bruce and what your advice is as we move into the holiday season. So welcome.
Thank you for having me, Carol. It's always a pleasure to be here.
Thank you.
So with the situation with COVID continues to be as stable as it has been in the past couple of months. And it is, I mentioned it many times, I wouldn't do it justice, the collective effort of everybody around the table and the community. The number of new cases is quite manageable. We've seen a couple of days or a number of days with increase from less than 5 to around 10, but it has not been a trend. It always goes up and down, which is quite manageable so long that baseline is the same. On the outbreak front, there has not been outbreak in Grey Bruce of significance. There was one outbreak of a couple of cases in a junior kindergarten class in one school. There has been many dismissed cohorts, around 40, 41 now, but without any evidence of transmission. So the collective effort to prevent the transmission, anytime we identify a case that was identified in the community at 10 school, we go and give the recommendation to prevent transmission, and we've been successful in this. So on the outbreak front, except for that minor outbreak, there are not outbreaks at this point. Schools, the rest of the schools, child care, long-term care, retirement homes, those are the high impact and sensitive sectors, all of them in good standing. The workplace, whether grocery stores or offices, again, there are not outbreaks. So this is literally as good as it gets for a fourth wave. And the question, how can we continue to maintain this level in the face of the increasing numbers provincially? A few health units are dealing with a significant surge, higher than any other time before. And in the face of potential new variant, the Omicron or Omicron, depending on you look at it, the name of it has some variability too. So the knowledge about this variant is not complete yet. That's one factor to look at. The fact that we're going in the holiday season, that's another variable we need to look at. The numbers in the province increasing, and we know people travel. People from Grey Bruce will go somewhere else to see their loved ones. So how we go back to that basic question, how can we maintain the relatively good situation we have here? And for that, I believe the community already knows the answer. We need to be vigilant. We need to continue to ensure that the risk of transmission is not there. For people who got the vaccine, that's great. That really reduces the risk significantly. For people who have not gotten the vaccine, if they can consider the safety, efficacy of the vaccine, that's something can help at this time. If they decide, and that's definitely their choice, not to get the vaccine, to be vigilant around the gatherings, the holiday gathering, family and friends. None of us want to bring COVID infection to our family. And I am confident, Carol, the response in Grey Bruce. Over the past 20 months, in every juncture, whenever we called for certain recommendations, it was delivered nicely by the majority of the public.
Mm-hmm. So I have a few questions. I always have questions, you know that. Just to drill down a little bit more, I watch the numbers. I watch the numbers every day, and I don't think I'm the only one. So of course I watch for Grey Bruce. So when I see the numbers go up a bit, my immediate reaction is, oh no. And you're saying to me, take it and look for a trend, not just 1 or 2 days of high numbers, right? So I should keep my oh no reaction controlled, correct?
Absolutely. And the first part that you always have questioned, that's a great thing. It was said a long time ago, the sense of wonder is the beginning of philosophy. If we don't have questions, we will never advance our knowledge. And you're correct. The data from 1 day or a few days is not reflective of a change in risk. It has to be a trend. And there are many reasons why data can increase on certain day or a number of days that are artifact. Like one example is the weekend. Many people are not inclined to go to testing centers on a weekend. Some testing centers' capacity are reduced anyways. So you would see that most of people who feel symptoms over the weekend will test on Monday, and you will see an increase on Wednesday or Thursday. There is always that extra number that comes there. Yeah. Monday, Tuesday results reflect the testing over the weekend, and they're less. So if there is reassurance or concern, it is an artifact. It's not real, and that's why we need to look at the trend. And that's one example of many things that we look at. And again, are we concerned with any increase? Yes. Anytime I see it going up, I need to examine whether it's an artifact or not, and hope for the best, but always be prepared for the worst.
So certainly here in Grey Bruce, the community has rallied around and done everything they can to work with the health unit, but we must continue to do that. That's the messaging I'm hearing from you, correct? As we move into gatherings and winter weather where we're in more than we're out, our work is not done.
And that's exactly the message. And we've known over the past 20 months, anytime there is an occasion similar to the holidays where people get together, there is a blip, there is increase in the data, could be significant right after. So that's why even if the numbers are low, we cannot lower our guard. We need to ensure that we're connecting with family and friends, which is very, very important, especially with the stress that everybody's experienced over the past 20 months. But it has to be done in balance.
Yeah. So if I have family members that I know have not been vaccinated, they have chosen not to, haven't seen them, they want to come and visit, what should I say? Bring your presents, but drop them at the door?
Well, it really is different from individual to another individual, from a family to another. But in general, if there is a person in the household that's potentially might have severe complications, it's probably best to be done virtually. Okay. If people are comfortable that everybody got the vaccine, and again, that's a question that could be so easy in some families and could be detrimental to a relationship in other families, and there is discretion there. The pandemic is with us for a number of months or whatever it is. Our relationships with our family and friends is lifelong, so we need to be sensitive about that. And I'll go back to this point after. I believe it's really important point. Ensuring that nobody is visiting when they have symptoms. I wouldn't shy away from this. Remind people if you have symptoms, or even when they arrive, to double check that if somebody is doing the 6-7 hour visit, sometimes if it's a whole day visit, if they're not feeling well, it's not the time to be shy from saying, I'm not feeling well, I need to leave, or so. If there are no vaccines, some physical distancing, mask could be warranted, and that definitely depending on the situation at hand, how many people, how crowded it is. The less the number are, the less the risk is.
Yeah, and certainly what I'm hearing is there is no right or wrong answer, that it depends on the individuals, their choices, and the family dynamics and situation. But being cautious is still the best approach.
Certainly.
Okay.
Definitely. Like I can give a personal example. My parents are older. They have a chronic disease that can be predispose them to severe disease. The first year without vaccine, simple as that, we're going to do this virtually 100%.
Mm-hmm. Mm-hmm.
And after the vaccine and when the numbers are low, the fact that the gathering is controlled to be small number of people, we had smaller visit with physical distancing inside the house. And again, you go into a surge. We discontinued these visits until things change.
Yeah.
So again, it's really different from family to family. There's always the information on our website. People to consult with their physician or nurse to see what level of concern they should have.
I pay attention when I read and get your media releases. When you have them in yellow, I know I need to really pay attention. And the most recent one of December the 8th around seasonal celebrations is stay home if you have symptoms, underlined, bolded, and yellow highlight. So that's a really important message to send forward for sure. So the booster. If I go ahead and get my booster, and I am scheduled to get it, will that take me to the same level of immunity I had after my second vaccine injection? How much does a booster boost?
It should very well do that or even more. And that's, again, there is variability among individuals depending on the age, depending on the level, the health, depending on potential conditions that affect immunity. But in general, the third dose would definitely boost that immunity. And immunity is, Carol, sometimes you would hear in the news or in articles, read in articles, the antibodies. There is decline in antibodies. We know antibodies are going to decline. Any disease affecting any person or vaccine is going to create antibodies as a response, and they taper down depending on but that's only one aspect of the immunity. There is a T cell and a B cell, and the B cell have memory, and they can reproduce all these antibodies as soon as they are run into the same virus or the same bacteria. But in general, the immunity will be augmented after the third dose. And if it's not, if the third dose, if a person is not eligible for the third dose at this point, that's good news. That means the window of time ensures that the immunity they have is sufficient to do the job. So there's no need for anxiety to say, like, I need the third dose earlier. It is based on recommendation and science.
Yeah, and your recommendation is, that it's wise to proceed with a third dose, the booster dose, especially as we're heading into conditions that might make us a little bit more susceptible, like we've discussed before. If I move forward with the third dose and have the booster, is it anticipated I will need a booster ongoing, or, how does this flow, or do we even know?
We don't know. This is one of the things that we don't know, and there are multiple opinions or two main schools of thought there. One of them is this might become endemic, similar to influenza, similar to pertussis, and regular vaccines or frequent influenza every year, pertussis every 3 to 5 years. And it could provide prevention. The other train of thought or school of thought, and that's where I actually, my thoughts are at this point, or my opinion is the fact that COVID-19 is part of the coronavirus family, and this family is known as common cold. We all know what it is, and we've witnessed the birth of a new, or the existence of a new strain, and it's going to cause a pandemic. then after a period of time, our immunity has been introduced to it, and we have sufficient immunity that the disease will become less severe and less severe to a degree that we don't need even booster or any concern other than what we have with common cold. Which scenario is going to pan out, or is it going to be a combination where a booster is needed for a number of years, then after that it wouldn't be needed? Nobody would know that answer.
We're still in process of learning about this virus and watching how it changes and how it affects people. What interests me is, and correct me if I'm wrong, but even though I've been vaccinated, I can still be a carrier of symptoms to someone else, correct?
If a person who's vaccinated got infected, they can spread the disease. But if they're not infected and the immunity is sufficient not to produce disease, they would not carry the disease.
So that's why masking is still important, because you don't really know. You can be carrying it and not yet demonstrate symptoms, correct?
Correct. If a person is infected and the infection is asymptomatic, and the vaccine would definitely help in reducing the severity of the disease, wearing a mask is warranted.
Yeah. So when we hear people are weary of this, they start to go over the screening questions as if they're just something to be tolerated. What would your advice be around the COVID fatigue and those who may comment, you know what, I've had it. I've just had it with this. I'm just going to go and live my life and do what I want to do. How do you respond to that? Because it's out there. People are saying it. And, we understand why. But what would your advice be as our medical officer of health?
Carol, I'm a realistic person, and as a medical officer of health, my specialty is pandemics, and I know that pandemics that go to this long will be accompanied with fatigue, and whether it's messaging fatigue or fatigue of different aspects of the issue altogether, including what you mentioned, where people will say, it is what it is, I'm going to just live with it. If we can find a bit more energy in all of us, and that's variable from time to time, it is definitely recommended. If we have that thought of, this itchiness in my throat that might be just nothing in the morning, or it could be the start of COVID that I might spread to other people, having that thought and having some thought about the potential consequences on other people might help us. If we start our day as if we are we're not infected, but as if we are infected, that might help us keep some distance from other people, and it's all in moderation and in balance. Like I can see how this becomes more hectic as we go in time in the pandemic, and becomes more hectic because we're going into the holidays, and this is the second season, and people missed out on their loved ones. Again, to the best of our ability, all of us, if we can consider this, and I know people don't want to hurt other people, especially their loved ones, if there's a potential for it.
When I first heard about the variant, the Omicron or Omicron, however you wish to say it, my first reaction was, oh no, we're going to have to go through this all over again. But this is not an unusual expectation of a virus and the variations of a virus. How many more variations are we reasonably expecting, or is this just a normal thing that we're going to hear about over the next few months?
So Omicron in Latin or Greek is a small o. The micron is like microwave, small wave. Omicron is small o, just versus capital. But we can say Omicron, and makes it a bit more.
A variant by any other name.
That's right. how many other variants? There will always be variants, but in general, in pandemics, the new variants are less severe than the previous ones. And we don't have full knowledge about this variant, and some of the early information and can change in a few days. That is it potentially escaping vaccine? No, the vaccine is actually still effective in preventing severe disease and complications, which is great news from this initial information. Is it more severe? It might not be more severe. Is it more infectious? Possibly. But all these are initial points of information about the characteristics of this virus, and we will know more in the coming few days, hopefully not weeks. In general, it is expected to have different variants of the virus in a pandemic. And as I mentioned before, we had a chat maybe a month before. Bear with me, Carol, here. I might be able to break it down in a straightforward way. If there are two variants and one of them is more severe than the other, the more severe is going to claim more lives and gonna not have the opportunity to spread more comparing to the other one. So natural selection is gonna take away the strong variants, the severe variants, and leave the benign ones. And that's when Delta variant was more severe. That was a surprise to me, because it's not expected. More infectious, yes, and we can deal with that so long as it's not causing disease. And the initial information that the Omicron variant might not be more severe. So we will see how that pan out. Sorry, I don't have anything but uncertainty about the Omicron at this point.
But what it says is that all along we've based our strategy collectively as a community and with the experts on evidence, on research, on information. And if it's not available, we have to continue with the uncertainty, but with all of the practices that we've been doing up till now, your 3 W's and all of your, the basic infection control strategies. But you will have to come back and give me the definitive information, Dr. Arra. So
I will definitely. And Carol, in emergency management, there's a saying that really captures the point we're talking about. There is a time to run, there is a time to slow down and walk, and there is a time to stop and observe. And with the Omicron variant, I would go with the last one. There's no need to, based on initial data, to actually initiate lockdown. I wouldn't see that a good strategy. Can we be cautious a bit more? Yes, we can. In the management of the cases, we're going to enhance management, and that entails few things. In Grey Bruce, most people really enjoyed the good work that all of us invested to ensure that our schools are open longer than anybody else, and people will return to work as soon as possible. And our goal in the management of the pandemic is not to lock it down. It's actually the opposite, to open it as fast as we can so long it's safe. So back to the Omicron, it's not the time to be excited. I need to see more data, and we will design interventions, and I have the confidence in our skills and our team and our community to deliver on ensuring the community remains safe.
So I will continue to watch your news releases and see where the highlighting is and the yellow and the underline for sure. I want to talk a little bit about the children and the vaccination rollout for children, and what you're hearing from parents who do have to make big decisions on behalf of their children. Would you like to explain a little bit how that's going in Grey Bruce with the rollout for the children?
Certainly, and if I can start with the process of approving vaccine for children and for, in general, any vaccine, there is a rigorous process of ensuring safety before anything, then efficacy as well. That process becomes more redundant, and redundant is a positive adjective here, to ensure that we're doing everything for the younger individuals, for children. And the fact that NACI, the National Advisory on Immunization, has approved the vaccine for 5 to 11. That is the strongest reassurance that it is safe and effective. And the rollout of vaccine for this age group in Grey Bruce started strong, continue to be strong. Our clinics are in general full. Children and parents are excited. We have invested in ensuring the environment of the clinic as friendly and entertaining as possible, including, the regular stickers that you would have up to a movie or to some program for kids to be entertained. Some of the feedback we received, whether anecdotal through email or through the epidemiology qualitative research, collecting information from parents and the staff. Some parents are describing it, my kids enjoyed it more than any other Christmas party. So, and we've seen, the provincial survey is good reflection of the situation in Grey Bruce as well. 50% of the parents want to give the vaccine immediately. 25% wanted to wait a bit longer to see the safety, and 25 decided this is not for my family, not for my child. And we respect any decision, and it is definitely an important decision for a family. What I would ask people who are waiting, or people who decided not to invest maybe 15 minutes per day for 3 days to look the data about safety and efficacy on credible website, whether it's Health Canada, Public Health Ontario, or the Health Unit.
Yeah. So just like we tell kids in school to do their homework, we're kind of encouraging parents and the public to do their homework and investigate further to help make the decision. We have about a minute left in the program. Are there any last messages before we head into the holiday season that you'd like to share?
Two messages there, Carol. One of them is we've invested a lot of effort to ensure the safety of our community, all of us, and this is the societal we. We can definitely enjoy the connection with family and friend in a safe way, whether it's virtual, whether it's in person, with the vigilant and the measures that we spoke about. The second point is to remember that it's a pandemic that's causing the hardship. It's not the other. It's not the traveler to Grey Bruce. It's not the person who decided not to take the vaccine. Yeah. We are a community. We're going to be working together for years to come, and this should not be a point of divide. We have high level of vaccine that's going to continue to provide immunity to everybody, including the people who are not vaccinated. And so long that we go through the holidays to ensure that well-being connection is there in a safe way, we can do justice to ensuring our community is safe. And wish everybody Merry Christmas and Happy Holidays. Thank you.
On that note, you've closed the program beautifully. All the best to you and all of yours, and to the staff at the Health Unit as well. Please join us again for more information about resources and services available to you and to your family. Take care and stay safe. Thank you.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
It's closing time, and you stayed out longer than you planned. So now you can't drive, and the buses have stopped running. You could always call your girlfriend